In this video, we're going to explore why so many people are prone to low back pain or herniated discs, particularly looking at L4-L5, L5-S1, and what you can do to reduce your risk of injury in those sections of your spine with nothing more than a yoga mat and a stool or chair. How's it going, guys? This is Dr. Chris Sovey back with another episode of Working Body Wednesdays. Working Body Wednesdays is where we talk about posture, functional movement, and hardening your body so it's better able to handle the demands of daily life. If that sounds like something that's interesting to you, be sure to subscribe and hit the little bell so you never miss another video again. We're going to spend a couple minutes explaining the why. So I'm going to do about 2 to 3 minutes of explaining the why you're prone to injuries, why we are prone as human beings, particularly in our modern society, to getting injuries in our low back. And then I'm going to go into the how. So I'm going to pull out the yoga mat and I'm going to show you some things on the stool specifically directed at preventing injury in the low back. These could apply to most people. Of course, I'm just always going to put out the disclaimer there. I always encourage people to be assessed by a professional if you're having an ongoing injury. This is more for preventative measures. First up, let's think about the low back related to our current environment and how so many people are spending time sitting for great periods of time, whether you're in school, whether you're working a job, whether you're unemployed or you're just at home. A lot of time in our lives is spent sitting. So the design of the human body is pretty well designed, but it's not made for our current culture of excessive sitting. So first up, one of the biggest risk factors for why we are so prone to injury in the low back is the amount of time we spend sitting at computers, at desks, doing our jobs, or whatever it might be that involves a lot of sitting. It creates an imbalance in the musculature. We end up with a lot of weakness, and things like the deep abdominals and muscles in the front of the chest get tight. A lot of the back extensors and hip musculature get weak, and other parts of the hip get tight. So we end up with a muscle imbalance, which when the hips get tight from all this sitting, a lot of the forces are transferred up the chain into the low back. Does that make sense, guys? Because if you don't have mobile and strong hips, then because you're connected, the next thing up the chain is going to be the low back. So if we have weak and tight hips at different areas of the hips, then that imbalance is going to take some of the forces, the compression forces, into our low back. Along with that, because we often lead sedentary lives, and we might spend 8 to 10 hours sitting, and then we think that an hour of going to the gym is going to counter all that. It really doesn't work like that. I highly encourage you guys, as a side note, if you haven't already, look into changing your work environment if you're somebody that has to sit a lot. So if you're somebody that has to sit a lot, you want to look at things like a standing desk or a treadmill desk. I've talked about that in some of my other videos that I'll be sure to put in the description below, and I'll also put up on top of the video here. So changing the work environment is critical so we can spend less time sitting, we can spend more time getting up and down and avoiding that stagnation. Also, a lot of the sitting creates weakness in the abdominals and also some of the back extensors as well. So we end up with more of an imbalance. We don't have the tiny muscles around the spine supporting the spine the way that it should. Another large problem with the change in the hips becoming tight is that it shifts our center of gravity up. So no longer are we moving through our hips well, so then we start moving excessively at the low back. So we often end up with a lot of shearing in the low back, and the low back wears out quicker because of this. So what do? A lot of people tend to start bending from their backs instead of bending from their hips. So when you're bending, we want to make sure that you are still drawing in the abdominals, that you're bending from your hips, and always bringing the object to you so you're not as likely to create forces in the low back and instead transferring those forces through your body appropriately. I highly encourage people to avoid lazy boy chairs whenever possible. Stop putting yourself in a position where, it's gonna tilt your hips back and you're gonna end up all flexed in your upper back, because that just creates a lot of nastiness through the entire spine. I do love Pilates for retraining both flexibility and functional strength, which is the name of the game once you're past your 20s and you're not trying to necessarily impress anybody with a lot of superficial things anymore. It's all about the functional core and being able to do the things that you need to do in your daily life. And then lastly, from another lifestyle perspective, guys, you want to get up at least once per hour. By doing so, we are resetting some of those muscles and making sure that they don't have time to tighten down. I've read recent studies that have showed as little as 30 minutes can make a change and shorten down some of those postural muscles, both in your hip and in your back. So we need to be getting up frequently, even if that just means getting up out of your chair, walking around for a couple minutes, doing a couple overhead stretches and stretching out the spine, and then sitting back down. That's incredibly important. I also have another video where I walk you through a series of desk stretches that I think you'd find highly beneficial if you're watching this video. But now let's talk about some things that you can specifically do. I'm going to go ahead and grab the yoga mat and on the stool here, and I'm going to show you some things that you can do to reduce the risk of injury in your low back. So first up, guys, we want to look at the balance of the musculature around the hips. And so first up, that is commonly tight on a lot of people is the hamstrings. So a great way to do this right at your desk is a seated hamstring stretch. If we're up nice and tall through the crown of the head, keeping a straight spine, I've got my left leg out straight down below here. It's straight out in front of me. I'm going to square the hips up, and then I'm going to hinge forward at the hips. I'm going to hold for just 2 or 3 seconds, and then I'm going to come back up. I'm going to do 10 of those. From the side, it looks like this. Got my leg out straight. I'm going to come up nice and tall through the spine, and then I'm going to hinge forward with just the hips. Notice I'm not moving much in the back at all. It's all happening from my pelvis. Now, if you didn't have tight hamstrings, you should be able to create a 90-degree angle at your hips, but for me, I feel pull almost immediately, so I know that that's something that I need to stretch. Next up is tight on a lot of people, and something for you to check is your piriformis. So seated piriformis stretch. Now, a quote-unquote normal length for the piriformis, you'd be able to put your knee so it's going straight across horizontal with the floor. And I'll notice that mine is propped up a little bit, so I know I have a little bit of a tight piriformis. Never push on your knee when doing this stretch. Line your hips up straight ahead, hip pointers going straight forward, weight on both butt cheeks, and then we're just going to bring the pubic bones down in the front of the pelvis, and you should feel a big stretch on the side back area of your butt. Again, I hold for a couple seconds and then I come back out, and with these stretches I would do about 8 to 10 per side. So we've got hamstring and piriformis, and then again for the low back we want to look at the hip flexors in the front, the psoas. So I'm going to show you 2 versions of that. A kneeling, half kneeling stretch where I level out the pelvis. I come tall through the crown of the head. This knee's up, this leg is straight down. Other foot is just behind me. And then I'm going to gently tuck the tail. And I already start to feel a stretch. My hip bones are lined up straight forward. You may have to lean into it a little bit to feel a stretch, but you shouldn't be way out here, way out forward. That little bit of a tuck and then just a little bit of a lean forward should be enough to give you a little bit of a stretch. You don't need to get a very intense stretch, maybe about a 6 out of 10 or so, nothing too intense. Again, I would hold for 3 to 4 seconds and I would repeat 10 times on each side. A standing option where you could put one leg in front of the other, a wall could be in front of you, and then you can start to bend your front leg and try and lengthen out the other leg behind you, so you're reaching out and stretching out the leg that's behind you. When you're bending, We want to make sure that we're not flexing from our low back, because this puts us at big time risk for herniating discs in the low back, especially if we're carrying any load in front of us. Instead, we want to elongate through the crown of the head. We want to keep the abdominals in, and we want to hinge at our hips to lift something into us close. Draw the core in and come back up. It's a lot safer way to pick things up off the ground. Also, because of the structure of the spine, combining twisting with flexion, so the motion of coming forward with the spine and turning is a big time risk for herniating a disc. So if you have to pick things up, always pivot yourself towards the object. Then again, we can bend at the hips like we learned, pull the object into you and come back up. If I'm facing this way and then I've got an object over here, we don't want to do one of these things where we're pulling it up and twisting, because that's how we herniate a disc, and that's how we get a low back injury. Always use the musculature in your hips. Take up all the available range of motion in your hips before anything else, because you don't want to get into a scenario where you're putting the force in your low back. Your hips are very mobile, they're very strong joints, and they're meant to take a great deal of force. So use those first before anything else. Up last is just a couple strengthening functional exercises that are keeping your low back in mind. It's very critical to be able to move the pelvis freely. So when we're on our back, you may have done this if you've ever done physical therapy before, where you are working on tilting of the pelvis and moving nothing else. No rib cage movement, no knee movement, and we're just working on moving the pelvis. You can take the pelvis into a circle clock around, keeping the pelvis mobile and letting nothing else move in the rib cage, so you're not just letting your ribs fly all over the place as you do this. It's not that. It's just the pubic bones sliding down between the legs and then the pubic bones lifting up the opposite direction. It's also critical to keep the back mobile itself, as long as you don't have any. This is a great exercise as long as you don't currently have an acute herniated disc. Reaching out through the knees, peeling each section away from the mat, growing long through those kneecaps. Once you get to the top, we take a breath in, and as you breathe out, we try and keep that reach through the knees, and then we lower down from the chest, the ribs, the belly, and then lastly, the pelvis. And then we roll back up through the spine, and we repeat that 5 times. As we start to do a couple of those, you can also work on shifting the pelvis to the left and to the right and sliding down the spine, the same idea. So we're introducing a little bit of shifting to mobilize your upper back, because we want that to stay mobile so the low back doesn't take as much force either. So we can slide to the left and to the right. We can also work on tilting one side of the pelvis down and the other side as we work our way through the spine, trying to keep that mobile. Lastly, I think a great one to always think about as we age, it's critical to think about keeping the extension of the hip, so making sure that the leg can get behind you, because you see as people get older, especially as they get into advanced years, they are starting to get into a shuffle gait where they're just kind of picking their legs up and they no longer can get that leg behind them. So after you've stretched out the hips, it's good to move into a movement pattern as well. So we're going onto the stomach. You can put a pillow underneath your stomach, and then from this position, we're going to keep on the video, I'm going to prop up a little bit here for a second so I can talk, but you're going to keep the forehead down, and then on a breath out, you're going to reach through the leg, elongate the back of the leg, and we're going to just get a little bit of a lift. Now, if you feel that all in your low back, then we need to break that down into pieces. So if that is stressful on your low back, then instead we're going to flex the toes, we're going to push the heel out, a little bit of a butt squeeze, and then we're just going to point the foot. And by doing that, we've broken it down, and now I'm getting a nice solid contraction in the glute. You can work up into pumping the leg, but again, we don't want to feel a lot of stress in the low back. If you feel any pain with any of these or discomfort at any point, then you need to stop. You do the same thing on the other side. You can always advance those into all kinds of things, which would be better if you were assessed and then you progress those with a physical therapist or working with a personal trainer. That's what that's the name of the game, is to always progress these things into functionally related tasks that apply to your life. What sorts of things do you do to reduce the risk of injury in your low back? I'd love to hear about it in the comment section below, so go ahead and leave a comment about your story. If you had any injuries, how did you recover? How have you stayed strong to prevent future injuries? Have you done things like modifying your workstation? Have you done a specific type of exercise, whether it's Pilates or yoga? I'd love to hear what's helped you the most in the comment section below. This is another episode of Working Body Wednesdays. I try to post every Wednesday at 5 p.m. Eastern Time, so be sure to check back next Wednesday. If you think a friend or family member would benefit from this video, please share that so I can continue to reach out and help more people. Thanks so much for stopping in today, guys, and I look forward to seeing you next Wednesday.